Marty, are you okay? Marty, it's Tina. I'm an emergency responder. May I help you? Marty? Marty? Hello, my name is Tina. I'm at 5746 Michael Street. Yeah, my neighbor just collapsed. Can you please send someone over? Thank you. Two and three and four and five and six and seven, 8 and 9 and 10, 11, 12, 13, 14, 15. Two and three and four and five and six and seven, 8 and 9 and 10, 11, 12, 13, 14, 15.
The Lifeline ABCDs answer all questions about what conditions to treat first. For instance, suppose a patient has serious bleeding and no signs of circulation. What do you do first? First, you go to A and assess the scene. Alert EMS and open the airway. Then you go to B and check for breathing. You find the patient isn't breathing and give 2 rescue breaths. At step C, for circulation, you find the patient's heart isn't beating and begin chest compressions. Rescue breaths and chest compressions take priority over serious bleeding. The Lifeline ABCDs lead you correctly to deal with the absent heartbeat before you deal with serious bleeding.
Let's look at primary assessment first with a responsive patient, and then with an unresponsive patient. A responsive patient is one who is alert and able to answer questions. Begin with assess the scene. Stop, think, and act. Sometimes you can don your gloves as you approach the patient. Next, give the responder statement, "Hello, my name is," your name. "I'm an emergency responder. May I help you?"
My name is Robin. I'm an emergency responder. May I help you?
Do not move the patient unless there's an immediate threat to you or the patient's safety. Because this patient is responsive and talking, you verified the airway, breathing, and circulation of her lifeline. Check for and treat serious bleeding, treat for shock, and treat for spinal injury, again without moving the patient. As you monitor the lifeline, alert the emergency medical service if and when you find any serious medical condition. Now let's look at primary assessment with an unresponsive patient. An unresponsive patient is one who is either completely unconscious or one who may be partly conscious but incapable of rational responses. Begin with assessing the scene. Stop, think, and act. Put on your gloves. Perform your assessment with the patient in the position you find him. First, give the responder statement.
Hello? My name is Eileen. I'm an emergency responder. May I help you?
You do this even with an unresponsive patient because he may still be able to hear you.
Hello?
If the patient doesn't respond to your statement, then tap him on the shoulder to further check responsiveness.
Are you
While
okay?
tapping the patient,
Are
you may ask,
okay?
"Are you okay?"
Are you okay?
The patient does not respond, so have someone alert the emergency medical service or do it yourself if you're alone. Open the airway using the head tilt chin lift. While lifting the bony part of his chin with your fingertips, put your hand on the patient's forehead and gently tilt his head back, like this. If you suspect neck injury, use only the chin lift, like this. Do not tilt the head or turn it from side to side. Hold the airway open and conduct a breathing check. Look, listen, and feel. Watch for the chest to rise and fall. Listen for breathing and try to feel his breath on your ear. Do this for about 10 seconds. This patient is breathing, so move on to C, circulation. If the patient were not breathing, you would perform a circulation check to look for signs of blood circulation. You'll learn the details for this when you learn skill 5, One Rescuer Adult CPR. This patient has a heartbeat and circulation, so D, defibrillation, to attempt to restart the heart isn't necessary. If it were, emergency medical personnel would attempt this when they arrive, or you may use an automated external defibrillator if available. You may learn more about these as you learn the emergency first response skills. Finally, you will check for and treat serious bleeding, shock, and spinal injury. After your primary assessment, you normally put a breathing, unresponsive patient in the recovery position. This decreases the risk of something blocking her airway and allows fluids to drain should she vomit. Keep the patient's head stable, in line with her body. This way, if there's an undetected spinal injury, you won't make it worse. Put the patient on her side. Put her lower arm near or under her head to keep her head in place. Use her upper leg to hold her in place. Continue to monitor her lifeline.
If during your primary assessment you discover that the patient isn't breathing, you'll use rescue breathing. Rescue breathing uses your breath to inflate the patient's lungs and provide oxygen. This works because we use only a small portion of the oxygen in each breath we take, leaving ample oxygen to support life. Rescue breathing is so effective that you can continue it for hours, provided the patient has a heartbeat.
As you've learned, you follow the ABCDs of the lifeline.
Hello?
Begin with assessing the scene. Stop, think, and act. Don your barriers. Next,
Hello?
give the responder statement.
My name is Mason. I'm an emergency responder. May I help you?
If the patient doesn't respond to your statement, then tap her on the shoulder and ask.
Are you okay?
If the patient does not respond, have someone call the emergency medical service,
Call for help.
or do so yourself if you're alone. Open the airway using the head tilt chin lift. If you suspect possible neck injury, use the chin lift only. Look, listen, and feel for breathing up to 10 seconds. If the patient isn't breathing, put her on her back if she's not already in that position. Remove any obstructions like dentures or gum from her mouth. Put the ventilation barrier in place as you've already learned. Pinch or block the patient's nose closed. Give 2 slow rescue breaths. Blow steadily into the patient's mouth, just enough to cause the chest to rise. After 2 slow breaths, perform a circulation check. You'll learn how to do this in a moment. It is important to note at this point that adult patients who are not breathing more than likely do not have a heartbeat. You will probably have to perform CPR as well. If the patient does begin to breathe on her own, continue to help the patient and maintain an open airway. Place her in the recovery position and continue to monitor her lifeline. If you cannot inflate the patient's lungs, recheck the airway for obstructions and proper position and try again. Improper position is the most common cause for a blocked airway. Try up to 5 times to give 2 breaths. Check for obstructions and open the airway. If you cannot inflate the patient's lungs after 5 times, you will begin CPR, which is the next skill you'll learn. If the patient has a mouth or jaw injury that may interfere with rescue breathing, gently hold the patient's mouth closed. Reposition your barrier over the patient's nose and give rescue breaths through the nose. Some barriers allow you to do this without repositioning them, and some may not work for on the nose at all.
Individuals in cardiac arrest do not breathe. However, some may gasp irregularly. This may seem like the patient is breathing. These are called agonal breaths. Agonal breaths sound something like this. Mistaking agonal breaths for actual breathing could mean not giving CPR and rescue breaths when you should. Therefore, it's important not to confuse agonal breaths with normal breathing.
If you find no signs of circulation when you make a circulation check, you will need to begin CPR chest compressions. This is the next skill you'll learn.
In the section on rescue breathing, you learned that if the patient doesn't have a heartbeat, you use CPR or cardiopulmonary resuscitation to circulate the patient's blood. CPR combines rescue breathing and chest compressions. If the heart isn't beating, rescue breaths alone don't benefit the patient.
Chest compressions work by moving blood with oxygen through the body to vital organs, even when the heart is stopped.
CPR is an emergency measure that can extend the window during which it may be possible to restart the heart. However, it only circulates about 1/3 as much blood as the heart, and it's difficult to sustain for long periods. Even with CPR, the sooner one attempts to restart the heart, the more likely it will restart. This is why it's important that emergency medical personnel arrive quickly and provide advanced cardiac life support, such as drugs, artificial airways, ventilation devices, and defibrillation.
Defibrillation is the process of restarting an erratic heart. Natural electrical impulses control your heartbeat. When these impulses fail, the heart beats erratically and no longer pumps blood. This is called fibrillation or twitching. Defibrillation administers a shock that momentarily disrupts the erratic signals and allows the normal heartbeat to return. As time passes, the probability of defibrillation restoring the heartbeat goes down. It is rare for a heart to resume beating without defibrillation, even with CPR. This is why you contact the emergency medical service first if you're alone and don't have someone else there to do it for you.
The benefit of prompt defibrillation was the reason for the development of automated external defibrillators, or AEDs. AEDs are defibrillators designed for use by lay emergency responders. AEDs electronically monitor the need for and administer a shock. Your instructor may provide AED instruction as part of this course.
I'm clear, you're clear.
Deliver shock now.
You will practice CPR using a CPR mannequin. Remember, do not perform chest compressions on someone who does not need CPR. Again, the ABCDs of the lifeline tell you where to start. Begin by assessing the scene. Stop, think, and act. Next, give the responder statement.
My name is Eileen. I'm an emergency responder. May I help you?
If the patient doesn't respond to your statement, then tap him on the shoulder and ask,
Are you okay? Are you okay?
alert the emergency medical service, then open the airway as you've already learned. Check for breathing. If the patient is breathing, then he also has a heartbeat. This patient isn't breathing, so follow your rescue breathing training and give 2 slow rescue breaths. After the 2 breaths, you will perform a circulation check. Remember, most adults who are not breathing also do not have a heartbeat. However, to further confirm that a patient's heart is not beating, perform a circulation check by listening again for breathing or coughing. Second, look the patient over for movement. If there's no breathing or movement, assume his heart is not beating. You will need to begin chest compressions. Move to the patient's side like this. Next, you would remove apparel to expose the chest. For the purpose of this video, often the chest will not be exposed. To find the compression site, follow the edge of the ribs up to the center. You will feel a notch at the lower end of the breastbone. Put your middle finger and index finger on this notch and, keeping your fingers there, put the heel of your other hand on the breastbone next to them. Put the hand from the notch on top and interlock your fingers, like this. If you forget this technique or have trouble with it, just put the heel of your hand in the chest center, between the nipples. Position yourself so you're directly over your hands with your arms straight. Then press down on the breastbone with enough force to depress it 4 to 5 centimeters, or 1.5 to 2 inches. Release and repeat for 15 compressions. The pace is fast, like this.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15.
This fast pace is about 100 compressions per minute. Now reopen the patient's airway and administer 2 slow rescue breaths. Follow this with finding the compression site and giving 15 more compressions. After approximately 1 minute of CPR, or 4 sets of 15 compressions and 2 breaths, give the patient a circulation check. If there's still no movement or breathing, continue CPR until EMS arrives, until you can defibrillate with an AED if available and allowable, until the patient shows signs of circulation, or until you're too exhausted to continue.
April, I'm an emergency responder. May I help you? Are you okay, April?
Is there anything I can do?
Call for help. April. April, this is Gwendolyn. Are you okay?
An unresponsive patient may have an obstructed airway and you can't give 2 slow rescue breaths to this patient. This may be because a choking patient loses consciousness or because of an unknown obstruction. If you cannot give 2 effective rescue breaths after checking for obstructions and trying to open the airway 5 times, move immediately to chest compressions. The CPR thrusts should dislodge any obstruction. Each time you open the airway, look for something blocking it in the back of the throat. If you see something, remove it. This is the only time you might give chest compressions to an unresponsive patient with signs of circulation.
What happened?
Greg cut himself on the saw. Can you call for help and wait outside for them till they get here and bring him back?
Okay.
Thanks.
Can I help with anything?
Yeah, could you get the first aid kit, please?
Yeah.
Thank you. Okay, Greg, try and elevate him here. Okay, try and keep your arm elevated here. Great, thanks. Wait, keep moving, Mary. Thanks. Okay, Greg. Get this on here. Hang in there, Greg.
The S of the Lifeline's A, B, C, Ds prompts you that after confirming the airway,